In corrections, my group consisting of Claudia Sanchez, Cameron Anderson, and myself, Chris Jordan, will be explaining mental health in prisons and jails. Mental health is defined as a wide range of conditions that affect mood, thinking, and behavior. As a group, we will be educating you on many of the mental health problems consisting in these systems and how prisons are acting on helping inmates with these serious problems. So we'll get started on these. My name is Chris Jordan, and I chose to focus on prevalent mental disorders in prison. And I did get the top five. Popular mental disorders would be number one, depression; two, mania; three, schizophrenia; four, PTSD; and five, anxiety. And I'll go further into detail in the next slides. Depression, a mental health disorder characterized by persistently depressed mood or loss of interest in activities, causing significant impairment in daily life. That was the most popular one. Two being mania, extremely elevated and excitable mood, usually associated with bipolar disorder. Third, we're going to have schizophrenia, a disorder that affects a person's ability to think, feel, and behave clearly. And then at number four, we're going to have PTSD, which is a disorder in which a person has difficulty recovering after experiencing or witnessing a terrifying event. Number five would be anxiety, a mental health disorder characterized by feelings of worry, anxiety, or fear that are strong enough to interfere with one's daily activities. I would say the most interesting aspects about these health disorders is that they all have one thing in common, and that would be their behavior change. These disorders are not only problems the people diagnosed have to deal with, but the safety of other inmates and staff are just as important. That is where the topics of mental health services and reform in order to combat these problems come into play.
Hi, I'm Cameron, and I'll be focusing on the types of treatment and services prisons have in order to combat the mental health problem. What treatments are provided and how well they are provided is the most essential aspect of this topic because it determines whether or not the prison inmates are getting the support they need. The Basic Mental Health Services Standard was created in 2008, and it was created to ensure that inmates with mental health problems are able to maintain their best level of functioning. Its main goal was to alleviate symptoms of serious mental disorders and to prevent relapse. I will be discussing aspects of this standard as well as other subtopics of mental health. The first thing we will be discussing is mental health courts. Mental health courts join the criminal justice and mental health systems together in order to place defendants where is best for them and where the community will be safest. The courts are designed to reduce the number of prison inmates by turning defendants with mental health disorders towards options other than prison so that they may get help that is suited for their needs and be in a setting that provides that. The next aspect of mental health treatment is group counseling. This is required in addition to individual counseling. Group counseling can be moderated by on site mental health staff, program staff, or community volunteers. Here, inmates can talk through any issues they may have as well as listen to others' stories and realize that they are not alone in whatever they may be going through. It is designed to promote emotional development, personal responsibility, and leadership skills. Overall, we do have systems in place for treatment of mental health in prisons, but there is much area to improve.
Hi, my name is Claudia Sanchez, and I will be presenting on improving mental health awareness within the criminal justice system. It is important to start off by bringing up the importance of training law enforcement officers about mental illness. This is significant because law enforcement officers are the first to respond to mental health crisis calls and decriminalize mental health illnesses. Research has shown that training police officers on mental health stigma significantly improves their responses to mental health crisis by identifying 6 common symptoms, known as sadness, anxiety, anger, mania, delusions, and hallucinations. In addition, correctional officers should also be trained on mental health illnesses. Research has shown that correctional institutions have become the front line for mental health. In order to provide inmates with appropriate help and assistance, correctional staff training must include identifying mental health signs and symptoms and must document behaviors adequately to provide for clinical professionals and case managers. However, there is limited access for inmates to receive counseling, therefore leaving inmates to not receive immediate help that they need during a mental health crisis. Research has shown that there is a need for effective communication and treatment staff should be involved all the way through program completion. Cultural competence is also a significant factor in improving the mental health wellness of inmates. Studies suggest that mental health service recipients may feel more comfortable getting treated by someone who is more culturally competent. However, race does not have to do with the treatment outcome, but it can help reduce mental health stigma within clients. Correctional diversion programs offered by mental health courts accept people with misdemeanor and felony offenses. However, the person has to show a history of mental illness or require formal screening and diagnosis of a psychiatric disorder. They also have to be willing to undergo mental health treatment, maintain sobriety, take prescribed medication, attend court hearings, and be under the supervision of a probation officer. Studies have shown that mental health court graduates are 56% less likely to get charged for a criminal offense compared to non-mental health court participants. And that is the end. Thank you for listening to our presentation.